YouTube, this is Kesmaina. Welcome back to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Karibuni. Today's topic is TSS, toxic shock syndrome, in relation to menstrual hygiene management. The reason I'm doing this is because it is common for people who use tampons and period sponges for management of their, menstrual hygiene management, as their option for that rather. So it is a rare but quite fatal and life-threatening condition that comes as a complication of certain bacterial infections. And it is caused by overgrowth of bacteria, which causes a release of toxins, and this toxin may end up into your bloodstream. And how they end up there is because there might be tears that you incur when you're inserting your tampon. You may incur tiny tears that you will not even feel painful or even any discomfort for when you're inserting your tampon. Now, your tampon is holding blood, holding your menstrual blood. So it is going to be a very good environment, a conducive environment for bacteria to multiply and rapidly grow, causing an overgrowth of the same. If this happens, then it is very likely for that overgrowth to lead into overproduction or release of toxins, which now these toxins will get into your bloodstream zikipitia through those tiny tears I'm talking about in your vaginal walls. And if that happens, now you may end up getting TSS. Now, this is common for people who use tampons and sponge for their menstrual hygiene management, but also it can happen for people who use cervical clamps and diaphragms. Hizo si za menstrual hygiene, hiyo sasa ni family planning. I talked about it some time back. And also for people who use pads, it's not common, but it can happen. And also for people who use menstrual cups, not common again. Can it happen? I don't think it can for menstrual cups users. Yeah, so that is how it comes about. It's just that normally we just have some bacteria on us, even on our skin and in our vagina. That's just normal. We just call them normal flora. Wako tu hapo na they are not causing you any harm. But overgrowth of the same will cause a release in toxins, and when these toxins end up in your bloodstream, it's going to cause you trouble. Okay, so signs and symptoms. This is how you will know that you're having TSS. You or mtu mwenye ako karibu na wewe utajua aje. The first thing, they will spike a fever, a sudden onset, and it's usually maybe above 39 degrees. Maybe you do not have a thermometer, but ukisikia tu ako na fever ama wewe mwenyewe uko na fever, and sometimes you'll have chills as well. That is one sign. Another thing, your blood pressure will drop. Now, of course, you don't have a blood pressure machine at home, but you will experience a headache, confusion, dizziness. You may have seizures as well. Yeah, those are some of the signs of low blood pressure. And if you experience that, then again, if you experience that and you have a fever, it could be, and you're on your period and you're using a tampon. Remember, this doesn't just happen. It has to, kidogo too. TSS can come about from other causes, but my main focus today is the menstrual aspect, the menstrual hygiene aspect, because of people who use tampons. Maybe on a later video, I'll talk about these other causes. So yeah, if you're having your period and you're using a tampon, you have a tampon on, and you experience now what I'm talking about, then you may know it could be a sign of the same. Not just because if you're sitting there and you're having these symptoms, now you think you have TSS, unless it's going to be about what we will talk about next. Another thing, you may experience nausea, vomiting, and diarrhea. Abdominal cramps, not so much, but it is a possibility. Joint pains, muscle pains, and muscle weakness. Now, a rash will be common, a red rash that looks like a sunburn. It may appear anywhere on the body, but it is very common on the palms of your hands and the soles of your feet. And then there will be eye redness and mouth. Your mucosa will be reddish and an irritating vulva. Your vagina will be a bit reddish and quite irritated. Yeah, so those are some of those signs and symptoms. Now, if you experience this and you have a tampon on, please just check it, put on a clean pad and go to the hospital. Uitoe tu saa hiyo. Ukianza kuexperience, hata kama ni fever tu umeanza kuexperience, you remove it and now you go to the hospital. When you go to the hospital, there are some tests your doctor will perform. They will draw your blood, they will take samples of your urine and take a swab from your cervix and a high vaginal swab. Wataingiza tu uko ndani na wachukue swab and send it to the lab for analysis. And then the results will come, the doctor will give you your result. Now, there are complications of the same. Now, the first complication is usually death, but death usually occurs, let me not say it's very common. It's not very common, but it can happen. And if it does happen, it happens usually within the first 48 hours. And well, it can happen even after 2 weeks, after 14 days, but it is more common. It's more likely to happen within the first 48 hours. Another complication will be organ damage. Yeah. Treatment, you will require antibiotic. Your low blood pressure will definitely require to be corrected. That is with IV fluids. You'll be given drugs to stop your nausea and vomiting. The fever, definitely lazima upatiwe dawa za kupunguza fever. And if there is organ damage, that will be sorted depending on which organ it is. That's why tulisema damu itatolewa and they'll take it to the lab and analyze and know exactly what to do for you. Now, I think we are done and I'm going to talk about the precautions, some cautions. Precautions, make sure you change your tampon or sponge 4 to 8 hours after insertion. Hata kama usikie kama imeja, just make sure you change, because if you stay with it for much too long, you're encouraging the overgrowth of bacteria and it might release toxins. It's si lazima, lakini it just might. Another thing, make sure you remove your tampon as soon as you've experienced the above symptoms. Remove your tampon. Don't put in a fresh one. Just put on a pad and go to the hospital. Yeah, that is it for today. Thank you for watching. Remember to subscribe, like and share. See you next time.